If you are over 60 and you sometimes skip meals because you are busy, tired, living alone, or just not hungry, I want you to stop and listen for a moment. This one habit can quietly affect your strength, your balance, your memory, your mood, and even the way some of your medicines work. And the hard part is this. The signs are often easy to miss. They may look like simple aging. A little dizziness when you stand. A shaky feeling in the morning. A foggy head around noon. A weak feeling in your legs. Poor sleep. Low energy. A small loss of appetite. Many people brush these things aside. But sometimes the real problem is much simpler than they think. They are not eating enough, and they are going too long without food. I'm Dr. Amelia Watson, and today I want to talk with you in a calm and honest way about why seniors should be careful about skipping meals. This is not about blaming anyone. Real life gets messy. Some people are caring for a spouse. Some are taking many pills. Some are grieving. Some are recovering from illness. Some just do not enjoy cooking anymore. And many older adults tell me the same thing. I'm just not that hungry these days. If that sounds like you, please know you are not alone. But here's the part many people miss. After 60, skipping meals can have a much bigger effect on the body than it did years ago. When you are younger, your body may bounce back faster from missing breakfast or eating a late lunch. But as we age, our bodies often become less forgiving. Muscle can shrink faster. Energy can drop more quickly. Balance can become more fragile. Some people also have health conditions like diabetes, heart disease, kidney problems, or digestive issues that make regular eating even more important. So this is not just about hunger. It is about staying steady, strong, and clear-headed. One of the biggest reasons meal skipping matters is blood sugar. Your brain and body need a steady source of fuel. When you go many hours without eating, you may feel weak, tired, cranky, shaky, lightheaded, or confused. Some people say they feel like their body is running on empty. That is because, in a way, it is. If you have diabetes, missing meals can be even more risky, especially if you take insulin or certain diabetes medicines. Low blood sugar can come on fast and make you sweaty, shaky, confused, or unsteady. That can quickly raise your chance of falling. If this topic speaks to you, let me know in the comments what meal you are most likely to skip. Is it breakfast, lunch, or dinner? And if you are watching for a parent, spouse, or loved one, tell me that too. I read those comments, and they help me know what you need most. If this kind of simple, honest health advice is helpful, please subscribe and stay with me, because in a moment I'm going to share the hidden signs of skipping meals that many families miss, and later I'll give you one very practical trick that can make eating easier even on days when you have no appetite at all. Now let's talk about something that surprises many people. Skipping meals is not always a choice. Sometimes it starts with a problem that hides in plain sight. Food may not taste the same. Dentures may feel loose. Dry mouth may make chewing hard. A medicine may cause nausea or reduce appetite. Constipation may make a person feel full all the time. Depression can take away interest in food. Loneliness can make eating alone feel sad. Arthritis can make cooking painful. Grocery shopping may become tiring. Memory problems can make someone forget whether they ate or not. So if you or someone you love keeps skipping meals, please do not assume it is just stubbornness. There may be a real reason behind it. Here is what often happens. At first, a person skips one meal now and then. Then they start eating smaller portions. Then they begin saying things like, "I'll eat later. I'm fine. I'm not really hungry. I already had something." But later never quite comes. Before long, their body starts sending distress signals. They feel more tired. They lose a little weight. They become more irritable. They have less patience. They feel less steady on their feet. They stop wanting to go out. They have a harder time climbing stairs or getting out of a chair. These changes can happen slowly enough that nobody notices until something bigger happens, like a fall, a fainting spell, or a trip to the doctor because they just do not feel right. That matters because eating too little can lead to muscle loss, and muscle loss in older adults is a serious issue. Muscle is what helps you stand up, walk safely, carry groceries, get off the toilet, open jars, lift laundry, and catch yourself if you trip. When meals are skipped often, the body may not get enough protein and energy to protect that muscle. And when muscle gets weaker, independence can start to slip away little by little. Many people think of food as just calories. But for older adults, food is also strength, balance, and protection. And there is another reason this matters. Skipping meals can affect the brain. If your body does not get enough fuel, you may have trouble focusing. You may feel more forgetful. You may find it harder to follow conversations or remember simple tasks. Some people say they feel like they are in a fog. Now, memory problems can have many causes, so I am not saying that missing lunch causes dementia. But I am saying this. Going too long without eating can absolutely make thinking feel worse, and when that happens over and over, daily life can become harder than it needs to be. Let's make this even more real. Imagine an older adult who wakes up late, has coffee, takes morning pills, and says they will eat later. Noon comes and they are busy or tired, so they just have a few crackers. By mid-afternoon they feel shaky, weak, and a little dizzy. They stand up quickly and the room spins for a moment. They think maybe they are just getting older. But what may really be happening is that their body has been underfueled for hours. This kind of routine is more common than people realize, and it can be especially risky for people with diabetes, low blood pressure, or a history of falls. Now this is important. Some medicines are meant to be taken with food. Others may upset the stomach if taken on an empty stomach. Some can make dizziness worse if you are not eating and drinking well. Blood pressure medicines, diabetes medicines, pain medicines, and other common prescriptions may all need a closer look if someone is regularly missing meals. This does not mean you should stop any medicine on your own. Please do not do that. But it does mean it is wise to ask your doctor or pharmacist, should I take this with food, and what should I do if I miss a meal? That one question can prevent a lot of trouble. There is also a hidden link between skipping meals and dehydration. People who eat less often also often drink less, even if they do not realize it. Then the body becomes low on fluids, and that can cause dry mouth, darker urine, headaches, constipation, dizziness, confusion, and weakness. In older adults, dehydration can increase the risk of falls and make a person feel suddenly worse. If you feel thirsty, weak, unusually tired, or dizzy when you stand, your body may be asking for both food and fluids. So what should you watch for? Here are the warning signs many people miss. Feeling shaky or weak before meals. Getting dizzy when you stand. Feeling confused or foggy in the late morning or afternoon. Losing weight without trying. Clothes fitting looser. Sleeping poorly and waking up tired. Having no energy to do normal tasks. Feeling colder than usual. Getting irritated easily. Needing to sit down more often. If several of these are showing up together, it is time to pay attention. Now I want to share an important truth that can bring some relief. The answer is not always eating huge meals. In fact, for many seniors, that does not work at all. Large meals may feel overwhelming. Appetite may be low. Chewing may be difficult. The better answer is often smaller meals or snacks at regular times. That means you do not have to force down a giant plate of food. You just need to stop going too long with nothing. Think simple and steady. A bowl of oatmeal with milk or nut butter. Yogurt with fruit. Scrambled eggs and toast. Soup with crackers and cheese. Half a sandwich. Cottage cheese with peaches. A banana with peanut butter. Beans and rice. Tuna salad on toast. A smoothie with yogurt, fruit, and maybe a spoon of peanut butter. These are not fancy meals, but they can be very helpful. If chewing is hard, choose softer foods. If cooking is tiring, keep easy foods in reach. If appetite is low, eat a little sooner instead of waiting until you feel very hungry. And here is the part one really want you to remember. Try to include protein during the day. Protein helps protect muscle, and muscle matters so much after 60. You do not need to make it complicated. Eggs, yogurt, milk, cottage cheese, beans, lentils, fish, chicken, tofu, and nut butters can all help. Pair that protein with something that gives your body steady energy, like fruit, oatmeal, whole grain toast, potatoes, rice, or soup. This simple mix can help you feel fuller, steadier, and stronger. Now let me give you the practical trick I promised earlier, because this one can change the game for many people. Create what I call a no-skip meal plan for your hardest time of day. Pick the meal you most often miss. Maybe it is breakfast, because mornings feel rushed or your stomach feels off. Maybe it is lunch, because you get distracted. Then build a tiny backup routine just for that meal. Keep 2 or 3 easy choices ready in the same place every day. Yogurt in the fridge. Oatmeal by the kettle. Crackers and peanut butter in the cabinet. Soup on the shelf. Frozen fruit for a smoothie. A boiled egg ready to go. The goal is not perfection. The goal is to make the better choice the easier choice. This matters because decision-making takes energy. If a meal feels hard, many people skip it. But if the food is simple, familiar, and right there, the chance of eating goes way up. And once that one meal becomes more regular, the rest of the day often gets easier too. Energy improves. Mood improves. Balance may improve. The body feels more cared for. If you are a caregiver, I want to speak to you for a moment. You may notice things before your loved one does. Maybe food in the fridge stays untouched. Maybe they say they ate, but there is no sign of a meal. Maybe they are losing weight, getting weaker, or seeming more forgetful. Try not to lead with pressure. Lead with curiosity and kindness. Ask, does food taste different now? Does your mouth hurt? Are you too tired to cook? Are you feeling sad? Are your pills making you nauseated? Is it hard to shop? Often the real issue is not refusal. It is a barrier that can be helped. Sometimes a small change can make a big difference. A grocery delivery. Softer foods. A dental check. A pill review with the pharmacist. More social meals. A timer reminder to eat. A chair in the kitchen so cooking feels less tiring. A weekly meal prep with family. These are simple supports, but simple supports can protect independence. Now, I also want to be clear about red flags. If someone has chest pain, trouble breathing, sudden confusion, fainting, severe weakness, signs of a stroke like one-sided weakness, or trouble speaking, black or bloody stools, repeated vomiting, or symptoms of very low blood sugar that do not improve quickly, get urgent medical help right away. And if appetite has dropped for several days, weight is falling, or eating is becoming a daily struggle, please talk with a healthcare professional soon. There may be an underlying problem that needs attention. There is no shame in needing help with meals. I want to say that again, because pride keeps many good people quiet. There is no shame in needing help with meals. Asking for support is not giving up. It is a smart way to protect your strength, your brain, your balance, and your future. Independence is not about doing everything alone. It is about doing what helps you stay well. So if you remember just one thing from today, let it be this. For seniors, skipping meals is not a small habit to ignore. It can affect blood sugar, medication safety, muscle strength, hydration, balance, and clear thinking. But the good news is just as important. Small changes can help. Regular meal times. Easy backup foods. Better hydration. A quick review of medicines. A little planning for low appetite days. These simple habits can make daily life feel safer and steadier. I want you to do one small thing after this video ends. Choose the meal you skip most often and make one simple plan for it today. Just one. Maybe it is oatmeal on the counter, yogurt in the fridge, soup in the pantry, eggs ready to cook. Keep it easy. Keep it realistic. That one step may help you feel more stable, more alert, and more in control than you expect. And if this message made you think of someone you love, please share it with them. You may help them notice a problem they thought was just part of getting older. If you are still with me, tell me in the comments which easy meal you would actually eat on a low-energy day. I would love to know. I'm Dr. Amelia Watson, and I want to help you stay strong, safe, and confident as you age, one simple habit at a time.